I'm Dr. Mokris with the Hip and Knee Center at OrthoCarolina, and today we're going to talk a little bit about the recovery after total hip and total knee replacement. When a patient has decided to have a joint replacement, oftentimes they want to know, how long am I going to be in the hospital? How long is therapy going to last? How long am I going to need help at home with somebody to be there for me? And when will I be able to return to work or back to my normal daily activities? Well, all patients are different. Patients have comorbidities. They have problems with their weight. They have problems with diabetes. They have problems with heart issues. We try to optimize our patients prior to surgery so that we can have them return safely and have a short recovery after their surgical procedure. For a hip replacement, normally patients are well at 4 to 6 weeks. For a knee replacement, it might be a little bit longer at 6 to 8 weeks because of the complexity of the knee joint. But again, this depends on the health of the patient. If I have an unhealthy, overweight patient, I'll probably try to optimize that patient by getting them into a weight reduction program, getting them nutritionally healthy, which will make their recovery much safer and much shorter. If a patient has heart issues, they may need to be tuned up as far as that is concerned. So for the most part, if I have a young healthy patient, that patient may be able to go home from the hospital the day of surgery. If I have a not so healthy patient, that patient may be in the hospital for 2, 3, or 4 days. Most patients do return to home. We like our patients to go home rather than to a nursing facility. And our studies show that the patients that do go home actually do better than the ones that go into a rehab center. So for a young healthy patient without medical problems, that patient may stay overnight or go home the same day. For an unhealthy patient, that patient may be there 2 to 3 days. Patient's physical therapy will begin immediately, and that can last for 4 to 6 weeks depending on the aggressiveness of the patient and how deconditioned the patient was prior to surgery. Patients do need somebody at home when they go home. They need somebody for 2 or 3 or 4 days. If a patient is healthy, it may be a couple days. If a patient is unhealthy, it may be a little bit longer than that. As far as walking aids, most of my patients are off walking aids by 4 weeks, some as long as 6 weeks, depending on the patient and again, how deconditioned they were prior to surgery and how many other comorbidities they have. Patients always want to know, when can I return to work? I'm a big believer in getting patients back to work immediately. I think work is good therapy. So when a patient wants to go back to work, I let them go back. If that's 2 weeks or 3 weeks, that is fine, if they can do it, if they have a sedentary job. If they have a more laborious job, such as a dock worker, it may be 8 to 10 to 12 weeks, depending on how much lifting and walking they need to do. So the recovery is dependent not only on what we do, but the patient's health, their conditioning, and hopefully we can all have a nice, short, safe stay for every one of our patients. Thank you.